everyone. It's Dellann from the End Brain Cancer Initiative. And I wanted to let you know why we're doing what we're calling our PCNSL online roundtable. So we know that there's a group of patients and their care partners who are living with this disease and who have asked for more resources. And they've asked for pharma and their healthcare providers to better understand what it's like to be a patient or a care partner for a patient who has been diagnosed with PCNSL. What we're really seeking are their unmet needs. And it's not just the time of diagnosis. They want resources and they want support all the way through the journey. What happened? What's your story?
But we did pick up 2 masses in your brain. I'm stunned. She's already got her iPad out and is researching cancer groups, cancers.
You're not alone. There are so many people that are going through the same.
I know my aunt has like a small group in where she actually goes take her medication. But I feel like more could be done.
The PCNSL was kind of this weird, you don't fit in anywhere. It's like, I already don't fit in. And now like these cancer groups are like, but you don't fit here, right? Like, so that's why I started that Facebook group. So there's a central nervous system lymphoma Facebook group. And I really started it because I felt I was alone.
What is it you wish your healthcare provider had told you or given to you when you were diagnosed?
I really didn't know what to expect at first until, it started happening, with the symptoms, some could just happen suddenly. You're not really expecting it.
One of the aspects I would say that I would love to have training on would be the aspects of medications. Needed, was not needed, when it should be given. But I feel like giving me a background check on while these medications are being prescribed, so I understand why she's taking it.
One of the basic main symptoms is the fact that it affects your speech over time and trying to communicate with people.
I had so I had a stem cell transplant. That's what's kind of cured me, right? They kind of rushed me through the process, which I'm grateful for that I'm healthy. But I wish I would have froze my eggs, like to have more kids. I was 29.
I didn't really understand the diagnosis at first. I wish he had told me that, it's like a genetic disorder. I did not know it was actually like from my gene or something like that.
What is it you wish to say to them, or what is it that they need to know?
I didn't have time. My tumor was growing and there was no time to spare. And that's the scariest thing about having something that grows rapidly.
Maybe I could ask about, do you need to come up with a new medication?
I wish the pharma industry could to like improve access to treatments, increase funding for rare cancers.
I wish there will be more medication that work faster. You understand? Try and make sure that the person is not passing through a lot of pains.
I would want them to actually focus on the cure symptoms, that actually affect our daily lives. Saying that they should mind the side effects, because new treatments like this have side effects that have not even been tested. So I feel like it should be tested well before, you try it on, patients.
Every patient is different. Everyone responds to different medication differently. So I would actually ask the pharmaceutical industry to try as much as possible to ensure that they put this in mind. And I would also try to ensure that they are using as much natural supplements as possible. I think that the price for a few of the medications are quite on the high side. If a little bit of breaking down in price would actually really help a lot.
When you're in remission, the fact that you're not cured, if a pharmaceutical company could say, here's the recommended protocol, I would be all on board for following something like that.